My name is Chuck Wadey, and this is my wife Amber. I was diagnosed with malignant melanoma at the age of 26. Obviously, with a diagnosis like that, I had a lot on my mind. But one of the biggest concerns I had was about my fertility. Amber and I had been married for about 5 years, and we weren't ready to start a family yet. But we always knew that kids would be a part of our future.
We were faced with some big decisions and only had a couple of days to figure everything out. Chuck's doctors told us there was no evidence that the chemo he would receive caused infertility, but we decided to play it safe and move forward with Chuck banking his sperm.
That was definitely a strange experience, but we felt good knowing we had a backup plan for the future. It was good to take control of something at a time when everything else seemed so uncertain.
As I'm getting a little bit older, I'm gonna start thinking about my fertility, and that's an important issue that I think doesn't ever get discussed. It was never brought up with me. No one still has ever said anything to me unless I ask about it.
The doctors didn't mention fertility issues until probably 3 years after I was off of treatment, that it could be an issue.
You know, some people get diagnosed and they have a few days to kind of get things in order, talk to other doctors, talk to fertility clinics, put something aside for the future. I didn't have that chance.
I think for a lot of people that are diagnosed with cancer, it happens so fast, and in most cases it's serious, and you don't have time to stop and think, okay, well, I'm 23 years old and I want to have kids one day, and you know, I want to freeze my eggs. I don't get that luxury. I did not get that luxury, as a lot of people don't.
There was nothing I could do. It would have postponed my treatment and, you know, possibly ultimately end my life. And that's, the doctors told me, you know, you can't be a mother if you're not alive.
Because of my cancer and because that I had to have a hysterectomy and chemo and radiation, I had to have my womb removed. I won't be able to conceive my own children.
Unfortunately, the chemotherapy that I was on is not good for fertility, and I have lost my fertility.
I was going to need radiation, and the radiation would include radiating my ovaries, and after 1 day of radiation they would be dead and they would not be able to produce eggs.
When I was first diagnosed, my mom and parents were worried about me having kids and the toxicity from the treatments and making me sterile. So before my treatments began, I went to a sperm bank.
They called in an OBGYN surgeon who repositioned my ovaries so that they were outside of the field of radiation. So now I went through 6 weeks of radiation. The ovaries were not radiated because they were outside of the field. And now my ovaries are still producing eggs, and hopefully someday I'll be able to have children.
I'm glad I did bank, because if I didn't, I might not ever be able to have kids. And I think at the time I really wasn't sure if I wanted to have kids, but now it's great to know that I have the option.
As you can see, we are pregnant and expecting a baby girl any day now.
That's right. Turns out infertility was not a side effect for me, but I'm so glad that I took the precaution of banking, because I would have regretted not doing it if things had turned out differently. The technology has been in place for men to bank sperm for a long time, and in the last decade, major medical advancements have allowed women to freeze their eggs for future use. In some cases, you can even choose treatments that won't affect your fertility.
If you're already past the point of banking your sperm or freezing your eggs, you can also consider donor sperm, donor eggs, in vitro fertilization, surrogacy, and of course, adoption. Here's the thing though, not all doctors are going to walk you through the process of preserving your fertility. You need to think fast and act fast. So even if you're not ready to start picking out baby names, talk to as many people as possible, including your doctor, and educate yourself about your options. You'll be glad you did. If you have questions about your fertility, it's important that you talk to your doctor and contact these cancer-related organizations for more information.